There is a quiet complaint I've been hearing more and more over the past decade. It doesn't come in the form of sharp pain or dramatic symptoms. Instead, patients lean in slightly, lower their voice, and say something like, "Doctor, I just don't feel right anymore." Not sick, not injured, just off. Their energy dips unpredictably. Their sleep feels lighter. Their body seems unfamiliar, and what concerns me most is how often they follow that statement with a shrug, as if it's simply the price of getting older. Now, here's the part that should give you pause. In many cases, it isn't aging at all. I have been practicing medicine for over 40 years. I have seen trends come and go, treatments rise and fall, and countless patients move through different stages of life. But there's a pattern I've come to recognize, a subtle decline that people normalize far too quickly. It doesn't happen overnight. It creeps in, quietly reshaping how you feel day to day. And because it's gradual, it often escapes attention. But when you step back and look closely, the signals are there. The body rarely becomes off without a reason. Now, before we go any further, let me say this clearly. What I'm sharing with you comes from decades of clinical experience, observation, and patterns I've seen in my patients. But this is not personal medical advice. Every individual is different, and if something doesn't feel right in your body, you should always speak directly with a qualified healthcare professional who can assess your specific situation. If you find this kind of discussion useful, take a moment to subscribe or simply keep listening. There's no urgency here, just information that may help you understand your body a little better. Now, let's look at what might actually be happening beneath the surface. When people describe this vague feeling of being off, they often mention things that seem unrelated. A slight brain fog in the morning, a strange heaviness in the afternoon, digestion that feels slower than it used to, sleep that no longer restores them. Small things, odd but persistent. And this is where most people get it wrong. They treat each symptom separately, or worse. They ignore them entirely. But in reality, these signals are often connected, forming a pattern that points to something deeper. One of the most overlooked causes is subtle dehydration. Not the dramatic kind that sends you to the hospital, but the chronic, low-level kind that quietly affects your energy, circulation, and even your mood. As we age, our sense of thirst becomes less reliable. Many people simply don't drink enough water throughout the day. And what's interesting is this. Even mild dehydration can make you feel mentally sluggish and physically fatigued without you ever realizing the cause. Now here's something few people realize. Your medications, yes, even the ones you've been taking for years, can shift how you feel in ways that are easy to miss. Blood pressure medications, for example, can sometimes lower your energy more than intended. Certain sleep aids can leave a lingering fog the next day. And, because these effects develop slowly, they're often mistaken for aging. But they're not. They're chemical influences that deserve careful review. Another common factor is poor sleep quality, not just sleep duration. Many individuals tell me, "I sleep 7 or 8 hours," but when we look closer, the sleep is fragmented, light, interrupted. And this is where it becomes critical. Sleep is not just rest, it is repair. If that repair process is compromised, even slightly, the effects accumulate. You wake up tired, your focus declines, and your body feels off. Let me pause here because this next point often surprises people. Blood sugar fluctuations, especially mild ones, can create a sense of instability in the body. You may not have diabetes. Your tests may even appear normal. But small spikes and dips throughout the day can lead to fatigue, irritability, and that vague, unsettled feeling. And most people never connect the dots. They assume it's stress or just a bad day. There is also the matter of muscle loss. Now, this doesn't mean becoming visibly weak. It can be subtle. A gradual decline in muscle mass affects your metabolism, your posture, even your balance. And here's the part that often gets ignored. Muscle is not just for movement. It plays a key role in how your body regulates energy. Lose enough of it, and you begin to feel it, not dramatically, but consistently. And this is where most people make a critical mistake. They reduce their physical activity because they feel tired, not realizing that inactivity is often the very cause of that fatigue. It becomes a cycle. Less movement leads to lower energy, which leads to even less movement. Over time, the body adapts downward, not because it has to, but because it's allowed to. There's another layer to this that rarely gets discussed. Low-grade inflammation. It doesn't show up as pain or swelling in obvious ways, but internally it can affect your joints, your brain, and your overall sense of well-being. Diet plays a role here. So does stress. So does lack of movement. And over time, this quiet inflammation can make your body feel heavier, slower, less responsive. Now let me bring all of this together for a moment. What you're feeling, the fatigue, the fog, the subtle discomfort, is rarely caused by a single issue. It's usually a combination. Slight dehydration, minor sleep disruption, small metabolic imbalances, reduced movement. Each one alone might not seem significant, but together, they create a noticeable shift in how you feel every day. So, what can you actually do about it? Start simple. Observe your patterns, not obsessively, just honestly. Are you drinking enough water? Is your sleep truly restful or just long? Are you moving your body regularly, even in small ways? And perhaps most importantly, have your medications been reviewed recently, not just renewed? These are practical steps, not dramatic ones, but they matter more than people think. You don't need to overhaul your entire life overnight. In fact, that rarely works. Instead, focus on consistency. Small adjustments, repeated daily. A glass of water in the morning. A short walk after meals. A slightly earlier bedtime. These are not impressive changes, but over weeks and months, they can restore something many people believe they've lost permanently. I've seen patients in their 70s regain clarity, energy, and stability, not through extreme interventions, but through awareness and correction of these subtle factors. And that, perhaps, is the most important point I can leave you with. Feeling off is not something you should simply accept. It is your body asking for attention, not surrender. If this resonated with you, consider sharing it with someone who might be quietly experiencing the same thing. And take a moment just today to notice how your body feels, not compared to the past, but in the present. Because that is where meaningful change begins.